So, Marty, obviously the Democrats will retain their majority. As you just said, there are some seats that are open and in play. What will this mean in terms of passing universal health care in the next session?
Well, I think that's why it's important to us to retain and hopefully expand our supermajority. We have 24 now. We'd like to add to that. There are 4 open seats around the state, 2 incumbent Republicans not running, 2 incumbent Democrats, several other races that were close last time and are rematches this time. So we hope that we can expand our majority. And health care clearly is going to be a major issue for us. The fact that Massachusetts has now passed a universal health care bill shows us that there can be a way of doing this at the state level. I mean, ultimately, the ultimate solution, I think, is a national health care plan, still a single-payer plan, as we've been talking about for years. But in the absence of a federal plan, we're going to have to try to do some things piecemeal at the state level. The Massachusetts model, I think, shows us that it is possible to have a state program. Now, it'll be somewhat more challenging, I think, for us to pass one in Connecticut than Massachusetts, because in Massachusetts, frankly, the business community and the insurance community sort of bought into the plan because they were, frankly, afraid that a more aggressive and ambitious plan might actually be passed by way of a ballot question or referendum. Since we don't have that option in Connecticut, there may not be the same leverage on the recalcitrant elements to come to support a plan, but we're committed to work on that and to push.
A supermajority means you can override a veto?
Right, that's right. Yeah.
Are you concerned that Jody Rowe would veto a universal health care plan?
Well, we don't know until we see the particulars of a plan, obviously, and but not only on that issue, but on a variety of issues, we need to have a supermajority. But obviously, we hope there'll be a Democratic governor, and that it won't be necessary to do veto.
Marty, if you had to predict, what are the chances that come next spring we're going to have a universal health care plan passed in Connecticut?
Looks like
I'd say it's better than 50-50.
Looks like a Yankee fan, too. He's got his